So the other day I went to the emergency room as a patient for the first time in my life. I started having a heart rate of like 180, 177 while running without much effort. And then I also started getting some chest discomfort. Obviously, you start worrying that is this a heart attack or not, even though I did not have other things such as sweating, anxiety, or out of breath or any of that. And because of the chest discomfort and also the unrelated or unexplained high heart rate, I decided to go after speaking with my ER friend. She's a doctor in the ER. So I got a troponin done, a blood test, as well as the EKG done. They put me on the monitor. Everything was normal. My troponin was not elevated. So in other words, I was not having a heart attack, and I was discharged home. Later that afternoon, I went to see a cardiologist, and I did a stress test as well. That was negative. So MI was ruled out, but the cardiologist did recommend to monitor my rhythm. So I have a portable, like a 2-week Holter that I'm going to wear at home, and let's see if I have like atrial fibrillation or atrial flutter, any of the rhythm disturbances that could also cause that kind of a sudden increase in heart rate. I have also been checking my heart rate with the Apple Watch, and so far I have not noticed anything. It's always been sinus rhythm, but that kind of made me face my mortality all of a sudden, when even though I knew I probably wasn't having a heart attack, but there is that small part that thinks that what if my EKG now shows a STEMI or an NSTEMI, what if I'm being rushed to the cath lab? So it just, as you're getting older, you kind of have to face your own mortality. Share with me if you have had an experience like that. But yeah, that was my first time going to the ER as an actual patient.